Morning, Miss Olaf. I'm Nurse Anna. I'll be taking care of you here today, this morning, in the emergency ward. How are you feeling right now?
Good morning, Nurse Anna. My hand is really painful and swollen. I got stung by a bee while I was carrying this morning.
I'm sorry to hear that. Let me take a look at your hand first. Okay, I can see the redness and the swelling here. When did exactly this thing happen?
About 2 hours ago.
Okay, did you remove the stinger yourself or did you leave it as it was?
I tried to scrape it out with my fingernail, but I'm not sure if it's still there or not.
That's okay. Before I do anything, I'm gonna explain what we're going to do, so you can decide if you're comfortable proceeding or not.
Okay, that sounds fine. I understand.
Okay, so first we're going to clean the area to prevent infection, and then I'm gonna remove the stinger by scraping it outwards, and then afterwards I'm gonna apply some hydrocortisone cream, which is a soothing cream, and then I'll apply some cold compress to make the pain and the swelling decrease. Just to make sure we're on the same page, can you explain to me what we're going to do?
So you gotta clean it first in the area, then you will remove the stinger, and then you put on some soothing cream and a cold compress.
That's exactly right. So, are you comfortable proceeding or not?
Yes, please go ahead, nurse.
Okay.
Ouch! It stings a little.
That's alright. You're doing great. Once I apply the cream and the cold compress, you'll feel better. Hold on. You were very brave. How do you feel now?
I feel a bit better. Can I go home after this?
We'll keep you about 30 minutes here, just for observation, just to make sure there's no allergic reaction such as difficulty breathing or dizziness. It's just a precaution, alright?
Okay, that's fine.
Okay, I'll be back in 30 minutes to see how you're doing, okay? Good morning, is this Dr. Elsa?
Yes, this is Dr. Elsa speaking.
Dr. Elsa, this is Nurse Anna calling from the emergency ward. I'd like to consult a patient named Miss Olaf, a 28-year-old female patient who came in about 30 minutes ago with a bee sting on her right hand.
Alright, Nurse Anna, go ahead.
Miss Olaf came in with swelling, redness, and pain on her right hand after a bee sting about 2 hours ago, without trouble breathing or dizziness. On examination, there is a redness and swelling on the back of her hand. No facial swelling or breathing problems. Her vital signs are stable with blood pressure 118 over 17 millimeters of mercury, and then her temperature 36.8 Celsius. Her pulse is 86 ppm and her respiration 20 per minute, and oxygen saturation 99% on room air. Her lab results shows a normal white blood cell count, and then the nursing care provided includes removing the stinger, cleaning the area with antiseptic, applying a cold compress, and then hydrocortisone cream. Based on my assessment, this seems to be a localized allergic reaction without signs of anaphylaxis. Could I have your recommendation on the next step for her care, doctor?
Please administer diphenhydramine 25 mg per oral 3 times a day. Continue to monitor for any signs of anaphylaxis, such as shortness of breath, wheezing, or facial swelling. If any of those occur, initiate the anaphylaxis protocol immediately and notify me at once.
Alright, I'll write it down. Allow me to confirm. Diphenhydramine. I'll spell it out. diphenhydramine. 25 milligram per oral. Continue to monitor for any signs of anaphylaxis. I'll notify you immediately if there's any changes.
That's correct. Thank you, Nurse Anna.
Thank you. So, the doctor has prescribed diphenhydramine for 25 milligram, which you should consume 3 times a day. It will help for your itching and swelling.
Thank you, nurse.
Okay, so how do you feel now? Any unusual symptoms or discomfort?
No, I feel fine. The swelling is still there a little, but the pain is much less.
That's good to hear. So, since your vital signs are stable and there's no reaction of no allergic reaction, so you're safe to go home. Here are your home care instructions you should bring home. If the swelling increases or you develop a shortness of breath or perhaps dizziness or rash, go to the emergency department immediately or call for help, okay?
Alright, I understand. Thank you for taking care of me.
You're welcome. You're very much welcome. Take care at home. Go take a rest at home, okay?